Okay, so here's our final 3 connective tissues that we're going to go over. Bone, spongy bone, and blood. These are very, very obvious. So here, again, starts at the 4x, the 10x, the 40x lenses. Here's the blow up. It looks a lot like tree rings because this is compact bone. This is what we think of when we say we break a bone. This is what makes up that hard outer shell. Okay? And in this case, we have osteones, right? Our osteocytes are actually these guys right here. Osteo meaning bone, cyte meaning cell, right? This whole thing right here is called an osteone. This guy right here in the center is our Haversian canals, or central canals that go through the bone. So this is where our actual blood vessels and stuff will go through. And then we have these little stringy guys that look like they're all coming down to connect to that central canal, right? And those are called cannuliculi. They come usually from these cells right here, the osteocytes and lacunae, right? And they reach forward and back, and those cannuliculi are how they get nutrients from the center of the bone, give back their waste, and it's how they communicate with the other cells. Next, you have your spongy bone. Spongy bone is what makes up the middle of most of our long bones, all of our long bones. What you have are trabeculae, which is kind of like a maze made up of the hard stuff, of the bone itself, right? And then you have these red spots in the middle. These red spots are actually empty spaces in the bone itself, and that empty space is filled with all of this stuff, which is actually red bone marrow, red blood cells, okay? So what we're looking for when we talk about spongy bone isn't the dark part in the middle, because that's going to be blood, which we're going to talk about next. It's this section right here, this lighter section. And again, you'll see this dark little osteocyte in a lacunae. You'll see them again here, and here, here, and here. You'll see it here, and here, and all of this stuff that I went over in blue earlier. This right here, just as a point of reference, when you get to the bones, right, this guy right here is your epiphyseal plate. You'll talk about that when you get to the bone sections. It's just fun to look at. Okay. That brings us down to blood. People don't think of blood as a tissue, but it is. And red blood cells have a very big distinction. So it looks like a bunch of sand right here at the 4x, right? It looks like a bunch of sand sitting on a glass table. Still looks like sand, or maybe some bugs sitting on it, right? But now, over here on the 40x lens, we can actually see these individual dots. Now, what's so distinctive about red blood cells is they don't have a nucleus. They're basically a donut, and this inside part, even though it's not hollow, it is empty, so that if you look at it from the side, it's not hollow, right? There's still the cell membrane there, but there's nothing in it, so it's nice and flat. These dark ones take up the stain really well, and the reason why is because they were white to begin with. And as soon as we say white blood cells, right, we know that those guys are actually leukocytes. The name for red blood cells, the official name, right, is erythrocytes. Eryth meaning red. And that is our final connective tissue.